Hello, everyone. I'm Jessica Sorbonne with Snakestaff Systems, and today we are here with a really special guest, Daniel Martin. Daniel was the lead investigator over a study that investigated the ETQ and the ETQ wide at the UT Health Science Center in San Antonio. Daniel, can you just tell us a little bit about who you are and your background?
I just graduated from the Department of Physician Assistant Studies at the Health Science Center at San Antonio. Prior to that, I did my undergraduate studies at Texas A&M. I have about 5 years of EMS experience, a few as an EMT basic and a few as a paramedic, and I currently work as a paramedic. I was an enlisted Marine with 2-1 out of Camp Pendleton for 4 years before that.
Can you please explain a little bit about the parameters of the study?
We modeled the methodology that we used after a trial that was done by the Army Institute of Surgical Research. The idea was to almost replicate, to pretty closely replicate that methodology. My understanding is it was in the early phases of the Department of Defense searching for a tourniquet device that they could field broadly across the DoD. So the Institute of Surgical Research reached out to manufacturers of devices that were on the market at the time and asked them to send in examples for testing. There were some devices that did really well, and you and I know the names of those devices, and they're still on the market. And there were some devices that didn't do particularly well, and some of them you probably wouldn't recognize the name. I'm pretty sure several of those are not on the market anymore. So our human adult volunteers were instructed on how to self-apply the tourniquets. Both designs were tested first in the leg by applying it to mid-thigh, and we used Doppler ultrasound devices, basically the same little doodad they use to listen just for baby's heartbeat. Not the one that makes the picture, but the one that just listens for the heartbeat. So we were listening behind the knee as they applied middle of the leg, and then the participants, volunteers, had to self-tighten until either we told them you can stop because we lost signals, or until they determined that it was too painful for them to continue tightening. Would have them then release the tension slowly to make sure that signals returned, which meant we lost signals because they actually had occluded flow and not because we had moved the probe out of position. 20 participants applied both designs, one to each leg, and then both designs met the 83% threshold for experiment 1 to move to experiment 2, during which participants had to self-apply to the arm while we listened with our devices at the wrist. Every device was applied to the leg 20 times, and each device was applied to an arm 20 times. Half of the arm applications were self-applied, one-handed, to the strong arm, and the windlass was manipulated with the participants' weak hand. Overwhelmingly witnessed successful loss of signals. I think we had one case in which a participant determined that it was too painful to continue tightening. In an emergency situation, perhaps mentality would be different, and if somebody was applying it to that participant, then they wouldn't necessarily have that limitation. So I think we marked one failure, but I would definitely caveat that it was not because of a device failure in terms of like a structural failure or anything like that. We had a reasonable spread of limb circumference and things like that, which, height, weight, limb circumference, we do record things like that. So that data will be recorded in the paper. But broadly speaking, I would expect both devices to work properly in an emergency situation.
Based on your expertise and the data that you gathered, what is your kind of overarching conclusion? Is this a device that you would recommend to medical professionals, to those who, like yourself, are medical professionals, but also just interested in personal preparedness? Is this something that you would give to your family to have in their home, just as added assurance? What's your take?
Yeah. I have to caveat slightly. Our data has not gone through peer review or publishing yet. So this is my sort of anecdotal personal experience as someone who's just watched, some 40 odd of these devices worked, which might be as many as anyone who doesn't work for Snakestaff Systems. But I would expect I would rank it as a serious device. I would recommend it personally, because I would expect it to do the job. I the overarching organizations who review data and all that sort of stuff will be able to weigh in when there are more things on the table, and hopefully as actual use cases come through, some of that will result in published case reports and things like that. But in terms of the my experience with the device so far, yes, I would describe it as a reliable and serious device that I would expect to do the job in an emergency.
Thank you so much for taking the time to talk to us today. It's been a pleasure, and we appreciate it.
Yep, absolutely. Grateful to be here.
Okay, bye.